The following is a review of the Practice of Cardiac Sonography 3 end of semester practical exam. The review includes the imaging tasks and questions that proved most difficult. Firstly, some points related to making 2D measurements. When measuring the aorta from the parasternal long axis view, use the zoom function to ensure that measurements are most accurate. Also, remember that measurements of the aorta are made using the leading edge to leading edge convention. A general observation based on acquisition of RV-focused apical four-chamber images. As the RV is the most anterior chamber, most often acquisition of an optimal image involves lateral movement of the probe away from the standard four-chamber window. Imaging the IVC can be difficult. Always aim to position the probe just to the right of midline. If imaging is a challenge, apply some more pressure as needed. Ask the patient to bend their knees and to inspire. Furthermore, color Doppler may help to identify the IVC. Also, importantly, make sure you are familiar with how to calculate right atrial pressure based on the size and reactivity of the IVC. A point about making Doppler measurements. Always try to optimize the spectral Doppler scale in order to improve the accuracy of measurements. Some points from the non-imaging stations. Questions in Station 4 were related to ventricular septal defects. One of the questions asked which cardiac chambers may become volume overloaded by a VSD. Just like the images at the bottom of this slide, which are from a young girl with a perimembranous lesion, VSDs can cause dilatation of the left-sided cardiac chambers. In Station 5 you were asked, can a small pericardial effusion cause cardiac tamponade? In one sentence explain why or why not. A small effusion can cause cardiac tamponade if it accumulates rapidly. Station 6 included a number of questions. After a myocardial infarction, MI, what kind of mass can form at the LV apex? Why would a mass form at the LV apex after an MI? And what possible complications are related to this kind of mass? Following an MI, apical akinesis may result. If so, poor blood circulation at the apex will be the result. In this setting, an apical thrombus may form. This can lead to a stroke if fragments of the thrombus become dislodged and enter the systemic circulation. For this reason, if a mobile thrombus like the one seen at the bottom of this slide is identified, the cardiologist needs to be promptly advised.